That information would be kept between him and his doctor.
All right, Mick, thank you very much. Now let me bring in NBC News military analyst and Medal of Honor recipient for his heroic actions during the Vietnam War, retired Army Colonel Jack Jacobs. Also with us, Dr. Joseph Calabrese, director of the Mood Disorders Program at UH Case Medical Center. Doctor, thank you so much for your time. I know that you're currently conducting a study on combat-related PTSD. What we've learned, and again, we can now show the photograph that we have of Specialist Lopez, is that he did not serve in a combat role, no direct involvement in a combat role. Can you suffer from PTSD and not be in a direct combat role? He was there for 4 months driving a truck. There is some disputed information as to whether or not he sustained any kind of head injury, but is that possible?
Well, Tamara, keep in mind that 85 to 90% of suicides are associated with a prior psychiatric diagnosis. So at the moment, we don't know what that diagnosis is, but it's highly likely that this suicide was associated with at least a major depression and anxiety. And whether or not he has PTSD, we don't really know.
We don't know. We know that he was being evaluated. Can you take us through the process of how that works now and the standards in place to determine that, and even how quickly something like that would be evaluated and then concluded?
Well, it's very difficult to do this quickly. Most patients who have these problems don't have one problem. It's very unusual for PTSD to occur by itself. The things that you consider in situations like this, number one, is depression. When people experience the symptoms of depression, if it's severe, they do experience feelings of worthlessness or helplessness, and these are the symptoms that lead to suicidal thoughts. In addition to depression, people in this situation typically have something called generalized anxiety, where they have difficulty controlling how much they worry about things and get excessively anxious about upcoming things. But what we know not infrequently triggers somebody who's just thinking morbid thoughts about depression to attempting suicide is the co-occurrence of alcohol abuse or dependence.
Colonel Jack, let me bring you into this conversation. I don't even know the opening question to you. Tremendous respect for everything you've done for this country and your perspective on wars fought when you were in service and these wars that these young men and women are fighting today here. We heard the president say heartbreaking. How do you process again and again at Fort Hood?
Yeah, it's very difficult to do. Of course, the two incidents are not directly related. A lot of similarities. And one of them revolves around the nature of the war we've been fighting for the last decade. I remember years ago when we were fighting, we fought toe-to-toe with the enemy, and no matter how scared you were, and you were scared all the time, you felt that you did have an impact on what the outcome would be. Whether you lived or died, in large measure, was a function of whether or not you and your buddies performed well, performed properly, performed the way in which you were trained. In the last decade, we've been fighting a war in which the large majority of people who have been killed and wounded were killed and wounded as a result of improvised explosive devices with no enemy contact, in a situation in which no matter what you do, it's irrelevant. You may become a casualty, and it's not dependent on how good you are as a soldier. And I think a lot of soldiers come back from this kind of environment with a feeling of helplessness, especially those who are emotionally fragile to start with.
And of course, we're learning more about Specialist Lopez's background and what his records will show here. But the fact that he was an E4 struck you. I heard you last night discussing that. This is all being pieced together right now, so we're not making any judgment calls or total assessment on his background, but what would that tell you at the point that he's been serving that long?
Yeah, it's quite astonishing. Somebody who's been 9 years in uniform, who is 34 years old, who is one of the lowest of the enlisted ranks. You'd expect somebody with that kind of experience, that kind of service, that time in uniform, to be at least a sergeant, and he was not. And so I'd be interested to know what his service record looked like, and the disclaimer that he never got into trouble is a little bit bizarre. I'd like to see all the rest of his file.
Regarding what Mick said in his report about medical records, obviously privacy is a great concern to all of us. None of us wants to believe that if something happened that any individual could go out and access our health records. But here you're looking at the United States Army. He was being treated for depression, anxiety. Those things may have been low bar. We don't know yet. We know how this ended, though, yesterday. What are your thoughts on, as Mick said, that the medical records of military personnel being one of the best kept secrets?
Well, it's absolutely correct. I mean, there's a great deal of political correctness around personal files like medical records, and that's been a development only recently. I think an interesting adjunct to that is the notion of how he acted among his peers in his unit. You know, because your father was in the service for his entire life, that a military community is a very, very close community. People live together, they work together, except during off-duty hours, which aren't many, by the way. They're never out of each other's sight. It's a bit like a family, and as a result, if somebody is going to be acting strangely, you know about it well before the fact. There's something wrong. You know there's something wrong.
So you think as this day proceeds, we are going to hear from other men and women who were in contact with him, and we'll know more about.
I'll be shocked if we don't.
Colonel Jack Jacobs, thank you so much. Dr. Calabrese, thank you as well for your insightful information. Thank you, sir.
You're welcome.
President Obama blasting Republicans challenging Democrats on the idea of raising the minimum wage. The president says next week, when there's a vote, they can talk the talk or walk the walk.
You got a choice. You can give America